most basic goals in Chinese medicine is to ensure a smooth and steady flow of qi through all the various meridians of the body, especially the primary meridians. In the context of this course, the goal of treatment is to create a well-balanced physical condition that facilitates ease in movement, which enables optimal performance. There are obvious relationships between the various meridians and the parts of the body those meridians pass through. Each type of meridian affects not only an area of the body, but certain layers of the body, as well as the substances and the tissues found there. The primary meridians, along with the sinew meridians and 8 extraordinary vessels, affect our ability to move our torso and extremities in certain ways. In his book, Sports Acupuncture, Dr. Mukaino Yoshito discusses how to diagnose and treat injuries and dysfunction by examining how the patient responds to various movements. Specifically, does a particular movement of the torso or an extremity recreate stiffness, fatigue, weakness, restriction, or pain? These movements assess the condition of the chain of muscles, joints, and other tissues related to the primary meridians, and to some extent the 8 extraordinary meridians, based on the trajectory of each meridian as it flows through the body. We can then influence the well-being and proper functioning of the whole body by stimulating appropriate points along these meridians. In these segments, we will introduce a simple method for checking the condition of the patient's body with movements that stretch the primary meridians. This will enable us to not only treat injuries, but also enhance conditioning and performance before the patient is injured and in pain. So here's the basic approach. The primary and 8 extraordinary meridians are stretched in specific ways to analyze the patient's movements. Each of these movements activates a chain of muscles that relate to specific meridians. We won't go into identifying all the muscles involved right now, but focus on identifying which meridians are imbalanced. We'll discuss the muscle involvement specifically later on as we cover each section of the body. It's worth noting that these tests determine which anatomical aspect of the body requires treatment and the meridians corresponding to that aspect. The 3 aspects of the body are the anterior, posterior, and medial lateral. From a 5-element perspective, the anterior aspect is governed by the metal and earth elements, and from a 6th division perspective, the anterior is governed by the Tai Yin and Yang Ming. The posterior is governed by the sovereign fire and water elements, and also governed by the Xiao Yin and Tai Yang. The medial lateral aspect is governed by the ministerial fire, that's the triple heater and pericardium, and the wood elements. And from a 6th division perspective, the medial lateral is governed by the Jui Yin and Xiao Yang. Looking at it from the 8 extraordinary vessels, as you'd expect, the anterior is governed by the conception vessel, the posterior is governed by the governing vessel, and the medial lateral is, of course, governed by Dai Mai. There are 30 total meridian stretches involving the torso, the head and neck, the arms and hands, and the legs and feet, and we will review the basic ones in these video segments.